Hello, welcome to the Alprazolam research review presentation. Come on in, have a seat, relax. Let's begin. So I'm going to give you a little background on benzodiazepine history. Alprazolam is a benzodiazepine. In 1955, benzodiazepine was identified by Leo Sternbach. By 1970, is made available in the 1960s, early 1960s. But by 1970, benzodiazepines replaced barbiturates as one of the most prescribed medication in the United States, which is a big deal because barbiturates were very popular. They used to be available just over the counter. You could just walk in and buy cornflakes and some barbiturates. However, many people became dependent, experienced a lot of repercussions from their pervasive use, and it became controlled. So when Leo Sternbach identified benzodiazepines and they became popular in the 70s, well, they were being marketed as a safer alternative to barbiturates. Okay, we'll revisit that later. In the early 1980s, benzodiazepine sales were worth $3 billion worldwide. So they became very, very popular. They still are. 2019, over 25 million Americans use benzodiazepines as prescribed. So that does not count the over 5 million who were using it illicitly in that same year. So alprazolam. Of the benzodiazepines, alprazolam is the most popular. It's among the most popular benzodiazepines used. People prefer it. And it's also one of the most prescribed psychotropic medications in the US, period. Now, alprazolam works on GABA A, and it also increases concentrations of dopamine and serotonin. So that dopamine circuit. Now, in the orange, you will see the on-label approved FDA uses for alprazolam. They include panic disorders and anxiety disorders with and without agoraphobia. In the green, you'll see some of the off-label uses that it is also prescribed for: depression, premenstrual syndrome, insomnia, and it's also prescribed for other things like pain and things like that. So, what are the desirable effects of alprazolam? One is the anxiolytic effect. So it helps people with anxiety, helps them feel calm. It has a sedating effect. It's anticonvulsant, and it's also a muscle relaxer. It relaxes the muscles. It does carry some adverse effects, as do most medications. Um, and here's some of them. Okay, some of them are more and some of them are less common, but a person could experience any one of these or a combination of them. Some people or some populations are more vulnerable to the adverse effects than others. So who can safely use alprazolam? Adults, including seniors. However, with seniors, there's a special consideration because their bodies are metabolizing it more slowly. Okay, it's taking longer to leave their bodies, and so the dosage has to be lower for seniors so that they're not accumulating too much of this drug in their system. Why do people prefer alprazolam? Because it works. It works quickly, it works well, it is effective, and it is potent. In fact, although it was being marketed back in the 70s as a safer alternative to barbiturates and kind of alleviating people's concerns, benzodiazepines are much more potent than barbiturates, so that's kind of interesting. But it's one of the reasons people prefer alprazolam. Strong, it's effective, it's fast. However, those are also some of the same reasons why it carries risk for addiction. Because it works so quickly and has a short half-life, it's affecting those reward centers in the brain, and withdrawal symptoms are fast and severe. So people want to avoid that withdrawal that they experience, and it can happen very quickly. Risk. So pregnant women need to definitely discuss the benefits, the pros and cons, and what's going to be best for them, because this medication can affect their child. The child can be born, the baby can be born with floppy baby syndrome. Also, they can be born dependent and having withdrawal symptoms because of the medication. So they just need to discuss that with their doctor, the obstetrician. Those with liver issues need to be aware that there is risk, and they need to make sure that that will be a safe choice for them. Seniors, as we mentioned, metabolize the medication more slowly. So they have special risks, like, for example, they're more vulnerable to dementia or Alzheimer's, fall risk, things like that, just because of the adverse effects and because of the way that their bodies are getting rid of that medication more slowly. They are, they need to make sure that their doctor lets them know about that and that they're aware of it for themselves. So children, this medication does not have a lot of research. It is not well supported by research for children. Now, some providers do prescribe it to children, but it is not common practice because it's not well researched. Okay, next, suicidality. So if alprazolam, benzodiazepines in general, and alprazolam in particular is indicated in a lot of suicides and a lot of accidental overdoses. So if someone is dealing with thoughts of suicide, it's definitely something that needs to be brought to the attention of the whoever is assisting them and treating them. Okay, those with a personal or family history of substance abuse are particularly vulnerable. They may have a genetic predisposition that makes them vulnerable to becoming dependent on substances easily or quickly. So that's something that people definitely need to be aware of. Those who drink alcohol or take other prescription medications need to know that mixing alcohol with alprazolam is dangerous, and it can cause death. Same thing with some prescription medications. It's important to discuss this with the pharmacist, discuss this with the doctor, the psychiatrist, the nurse practitioner, whomever, to make sure that that you're being safe as possible. Now, I wanted to briefly go over some warning signs of drug dependence, just because this medication, there's a lot of research, a lot of documentation that there is a very high risk for dependence with this one. So I thought it would be important. We'll go over them very quickly. So doctor shopping, looking for multiple doctors to ensure that the person has a steady supply. These are all red flags. Stealing money or medication, that may seem obvious, but the person may not think of it as stealing. They may think of it as, oh, my aunt's, my grandma, my whoever's medication, they don't need all this. They won't miss, they won't miss this one. They won't miss this couple. Same thing. Isolating oneself or alienating oneself from loved ones, or carrying outsiders who may notice, hey, this medication is indicated like for 4 to 6 weeks. Short-term use only is the safest route, but I noticed you've been on it for like 5 years. Maybe you should talk to somebody, or maybe you might want to think about talking to someone. But if they're like, no, you're judging me, you don't understand, nobody understands, that might be a red flag. Neglecting responsibilities. We already discussed a history of substance abuse, personal or in the family. Diminished self-confidence, when a person starts feeling that they need the drug just to feel normal, just to feel okay. Purchasing it from the street. That may not be so obvious. It doesn't mean that someone's down in a dark alley copying a drug from someone, an addict, a dealer in the corner. It could mean buying it from a neighbor. It could mean, you know, buying a couple pills from a cousin. Basically, you're not getting it in the legal way. You're not getting it from mostly from a prescriber who is licensed and knowledgeable and can monitor your use and your dosage for your safety. So, yeah. And one that may seem obvious, but they want to stop, but they can't. I'm tired of taking this drug. I've been on it for so long. I really wish I could stop. I can't stop. So all of those may be some warning signs, just to be aware of. Next, some precautions. Alprazolam should be taken only when prescribed by a doctor. It should not be taken longer than necessary. Individuals should not increase or alter frequency or dosage without first consulting their doctor. Tapering or cessation should be monitored by one's medical provider. Individuals with depression may be more vulnerable to suicide. Individuals need to be knowledgeable about signs of abuse or dependence. And those who see some signs, some warning signs, or have concerns, I definitely encourage them to seek professional help. There is help out there. Conclusion, alprazolam is not a demon drug. It is a medication that has helped a lot of people. It's potent, it's effective. It's used to treat several disorders. However, there are risks. There are well-documented risks that consumers need to be aware of. There is a high potential for dependence and severe, swift withdrawal. Seniors and children are more vulnerable to the adverse effects, and those with a history of substance abuse, you know, may want to consider alternatives to benzodiazepine treatment for their own safety. Those taking alprazolam should only use it according to medical advice and shouldn't increase or alter dosing without doctor's knowledge. Tapering and cessation should be monitored by a medical professional for one's safety. So if you or someone you know is concerned about substance abuse, please reach out for professional help. There are people out there who will not judge you, who will not judge your loved one. So here is the number to a national substance abuse and mental health hotline, 1-800-662-4357, 1-800-662-4357. Here are some references. Feel free to look over. And lastly, 5 quiz questions. 1. What year did scientist Leo Sternbach discover benzodiazepines? 2. List 3 desirable effects of alprazolam. 3. Alprazolam works on blank and increases concentrations of blank and serotonin. Number 4. List 3 adverse effects of alprazolam. And number 5. Which group metabolizes alprazolam more slowly? A. Children. B. Women. C. Seniors. Or D. Seniors and children. Thank you so much for taking the time to look at this research review. Have a great day.